Providing Peri care for the female patient. Good Peri care promotes good personal hygiene. If not performed correctly, it can lead to infection, bacterial or yeast, foul odor, and loss of patient dignity. You will have 6 to 7 minutes to complete this skill. You will need 4 washcloths, a large towel, a large basin, soap, gloves, and a privacy blanket.
Good morning, Mrs. Johnson. I'm Nicole, who's going to be your caregiver today. I'm going to check your name tag. Okay, so I'm just going to clean you up a little bit, do a little Peri care. Is that okay? Okay, great. I'm just going to go ahead and bring your bed up to waist level so I can protect my back. You always want to protect your back when you're taking care of your patients. Okay, we're going to go ahead and walk to the other side of your bed and put the side rail up. Okay. Put the side rail up just to make sure the patient is safe. When you roll her over on the side, when we clean the back side. And so I'm also going to give her a little privacy. I'm going to close the privacy screen. Okay, so Mrs. Johnson, I'm just going to go and wash my hands and get my supplies, and I'll be right back. So I'll go out. We simulate washing hands for the purposes of the state. We don't have to wash our hands for real during the skill. So now we're going to do the pre-prep, which is bring the sheet to the waist. And then we put the blanket over top to cover where the sheet no longer is. You don't want to shake the linen. You don't want to put any linen against your body. You want to have the open flaps at the top of the bed. That way when you have to open the blanket up, you can without any difficulty. Okay. So now I'm just going to go ahead and take all the supplies out, set them on the table. Then I'm going to go to the sink, Mrs. Johnson, and wash my hands and get your water. I'll be right back. We're going to go to the sink. Okay, we go ahead and turn the water on. We simulate washing hands for the purposes of state. You want to test the water, make sure it's not too hot, not too cold. No more than 105 degrees for the patients. So we don't burn them. Let me go ahead and fill the water, fill the bucket up. You don't have to put a whole lot, maybe about halfway. For testing purposes, we can go a little bit less than that. We want to make sure we have enough water to wash as well as rinse. Okay, once we have enough water, go ahead and pull the bucket out. You want to grab a paper towel. You want to turn the water off. The faucet is considered contaminated, so go ahead and just turn that off. Throw that away. And then we go ahead and walk back over to the bedside, and don't forget your soap. So we come back over. So I've already tested the water. It feels good to me. So now we're going to let Mrs. Johnson test the water without exposing her too much. Mrs. Johnson says the water is great. Okay, so now once the patient says the water is good, then at this point you can go ahead and put your gloves on. We're going to go ahead and put the sheet down to the knees. Only expose the body part we're going to be using. Going to help maintain patient dignity and warmth as much as possible. Then we take our towel. This is how we fold. We fold it in half. And then we fold it in half one more time. We keep the open flaps on the top so you can have access to them. Let me go ahead and tuck the towel under the patient's leg, just a little bit on the far end from you. And then the rest of it goes up under the leg that's closest to you. Okay, so now we go ahead and we get our water. You wet the washcloth in the bucket. You want to put your soap on the washcloth. Then we lather it up. We don't want to lather up over the water because that's also our rinse water. Okay, so we're going to wash 4 different times, which means we use 4 different flaps. So we wash down the middle first, flip it backwards, wash down the middle again, flip backwards, Let me wash the side, including the groin. Let me wash the other side, including the groin. That goes into the dirty laundry. Now we rinse. Remember, whenever you wash, you want to rinse, and then you want to dry. Get all the soap off so we don't cause skin irritation. So we do the same format. So we go down the middle, the labia area, down the middle again, flipping a washcloth each time. We go down the side, down the other side. And now we want to pat dry. So the towel is furthest away. We want to pat dry top to bottom. Pat dry. And you don't want to, once you go down, you can't go back up. So we tuck it, that's wet. And now we do one more time, just to make sure it's really dry. We pat down, and we tuck that again. Okay, Mrs. Johnson, we're all finished with the front. I'm just gonna cover you up and roll you over on your back side. I'm gonna open the blanket all the way, give her full coverage. Arm that's farthest away from you, we're gonna go ahead and put that above her head. That way she doesn't lay on it. The arm that's closest to you goes across her chest. That way she can grab hold to the side rail if she's able. We're going to bend the knees way up tall. We're going to put one hand on the waist hip area, the other hand under the shoulder. And we're going to do a count of 3. So on the count of 3, Mrs. Johnson, we're going to roll over, okay? 1, 2, roll her over, get her in a nice good position there. And just go ahead and cover her arm back up so she stays warm. Now we only want her bottom to show. Everything else stays warm and covered. So we do the same thing. We wet the washcloth. We get the soap. Really thick. Then we lather it up away from the bucket of water. Lather it up. And then we do the same process. We go middle, middle, side, side. This time we're going from the bottom towards the head. So you always want the front, we go top to bottom. The back, we go bottom to top. We go in the middle, we want to say avoiding the bed sore. Flip it. Middle again, avoiding the bed sore. Flip. And we go each cheek. 1 and 2. Again, we're going towards the head. So now we're going to rinse it. Doing the same exact process. Get out. We do the middle. Avoiding the bed sore. Flip it. Middle again, avoiding the bed sore. And we do the outside area. Using a clean flap each time. And so now we're going to use the towel that's closest to us to dry the back side. Same process, you're going to dry in the same direction that you wash. So pat dry bottom to top. Tuck that wet part in. Do it one more time. Pat dry bottom to top. Tuck that in. So now we want to dispose of the towel that's wet. We want to roll it away from the patient and away from you. So we go a little bit of an angle. Roll it up in a ball. Put it in the dirty clothes. Okay, Mrs. Johnson, I'm just going to cover you back up and flip you back on your back. On the count of 3, we're going to roll over. 1, 2, 3. Good job. Straighten the legs out. Get her covered back up. Okay, now we just want to reach under the sheet without exposing. Be very careful not to overexpose your patient. Bring everything down. Now we're just going to start bringing the blanket up so we can dispose of the dirty laundry. So when we get the blanket and the sheet to the waist, we stop and then we roll the blanket away from the patient. You never want to roll the blanket into the patient's face. Make sure it's in the ball so it doesn't touch you or the floor. In the ball. We go ahead and cover her up. I'll be right back, Mrs. Johnson. I'm just going to go ahead and dump my water. I'm going to go to the sink. We want to put the soap away in the designated area. Dump the water. Okay, then we're going to rinse. I always want to rinse it out when you're done. So rinse and dump, rinse and dump. And we take a couple of paper towels and we pat it dry. Make sure it's nice and dry before you put it away. Water harbors a lot of bacteria. We're going to put this away in the designated area. And we're going to take our gloves off the correct way without contaminating your hands. dispose of those into the garbage can. Again, we simulate washing hands for the purposes of state testing. Take a clean paper towel, turn the faucet off. Let me go back over and do our 5 afters. Okay, Mrs. Johnson, we're all done. I'm just going to go ahead and get you settled. Put your bed back down into the lowest position. For safety purposes, the bed has to go all the way down. Okay, I'm going to go ahead and sit the other side of your bed and put the side rail down. The side rail is considered a restraint, so we always want to remove it when we're done. Remove the privacy. Get her sheet fixed up. Make sure your patient's nice and neat and comfortable before you leave her. Okay, and here's your call light in case you need me. Is there anything I can do for you before I leave? Okay, great. Thank you and have a very nice day. We walk out, we wash your hands, and we document.